Good evening, everybody. I hope you had your dinner or dinner is waiting and not getting cold. Thank you very much for joining. We have today Professor Dr. Kenji Shibuya as our guest speaker. I don't want to repeat everything we have already conveyed on our online introduction of today's speaker, but I would like to give you some other milestones. For example, he was born in 1966, where, I don't know, what month, I don't know. But anyway, I'm glad that he is with us tonight. What I found out was actually that he graduated in 1991 from the Tokyo University and got his doctor's license the same year. In 1999, he received his PhD in public health from Harvard University and became an assistant professor at the Tokyo University School of Medicine. In 2001, he was appointed senior scientist of the World Health Organization, and 4 years later was appointed director of the WHO Health Statistics and Evidence Unit. Now, of course, the list goes on, and there's many things we could basically line up here, but I like to jump to 2015 and mention that under the third Abe cabinet, Minister Shiozaki, he was also appointed chairman of the Healthcare 2035 meeting. A big change in his career was certainly his resignation as a professor at the Todai and becoming a visiting professor when being appointed director of the Population Health Institute at King's College in London and appointed as a representative of No Border Company Limited. Now, since Professor Dr. Shibuya specializes in depth analysis, risk factor analysis, cost effectiveness analysis, and health system performance analysis, is without doubt the perfect person to analyze all in regard to the current COVID-19 crisis. Professor Shibuya, please help us to make sense of it all. Yoroshiku onegaishimasu.
Thank you very much for your kind introduction, and I'm very delighted to join this event tonight with you. And I think it's a dinner time in Tokyo, so I hope you will enjoy my talk over very good Swiss white wine. So let me share with you my slide. So basically, for the next half an hour to 40 minutes, I'll talk about response to the COVID pandemic and so mostly lessons from Japan and abroad. I'm currently living in London, so my experience is more on the from the UK, but I'll touch upon more on the global cause of pandemic pathway in the future as well. So let me talk about three things today. First, I would like to talk about a little bit about the response in the UK and Japan, because these two countries seems to be following the similar path in the sense that both countries are island, but also in terms of response, they are primarily focusing on the economy rather than infection control. So they primarily adopt a strategy for mitigation. They are changing a little bit right now, particularly in the UK. And also, because of that, the government response to suppress the transmission was delayed. And secondly, I will talk about the exit strategy for the second or third wave, whatever that is for now. And then I'll conclude my talk about my proposal toward zero COVID strategy. So let me start from this COVID response in the UK and Japan. So if you look at this COVID response ranked by think tank, Japan and Britain, United Kingdom are not doing well. This is, I think, the ranking at the time of 9th of January this year. So, and I think Japan is currently following the path which the UK had gone through with a 2 to 3 months time lag. Let me explain why. So in the UK, if you recall what happened in Europe, particularly during before the summer vacation, the UK lifted the first lockdown, and as you recall, people are relaxed and summer vacation, and then there was travel bubble, so there was air travel without any quarantine for some countries. With a negative proof of PCR testing, so vacation, and then because of the summertime, people didn't wear masks, and the UK tried to push the economy by implementing so-called Eat Out to help out. It's like a Go to Eat campaign in Japan to support the restaurant, the bars, and back to school, and the fall season came in. So that led to a big resurgence in September. And already in September 21st, expert panel requests the Prime Minister to implement a 2-week circuit breaker. It's a mini lockdown for a short period of time to suppress the transmission at a very early stage. If you look at the picture, the guy banging on the table is Chris Whitty. I know him very well from the London School of Tropical Medicine Hygiene era. He's a great infectious disease and public health person, but I have never seen he's so angry in this picture. And Chris Whitty is the Chief Medical Officer of England, and he's taking a lead on the UK response. But Boris didn't listen to him, and he didn't do anything, and just asking people to be cautious. Which sounds very familiar to all of you living in Japan right now. And 30th October, Labour Party demanded a full-scale lockdown. And next day, experts suggested the infection rate was exceeding the worst-case scenario. And they have a bunch of contingency using mathematical models. But they warned the Prime Minister that it was getting very, very badly. So it was very delayed, and the Prime Minister implemented the second lockdown after 6 weeks from the initial request from the expert. So on 5th of November, he implemented a second lockdown, and he promised the general public it's only for 4 weeks, because he worried about the Christmas time. And of course, the approval rating was falling down very quickly because of this. And surprisingly, despite the fact the cases were not going down enough, he lifted the lockdown as promised on the 2nd December. But it was time of Christmas, and people went out, and of course, the people are mingling, having dinner in-house. So the situation became actually was getting worse. On top of that, there was rapid evolution of new variant, which is the UK variant B.1.1.7, and it was replacing the wild COVID very quickly, partly because people were interacting again. So because of this, lifting the lockdown, despite the cases were still very high, and because of new variant, there was again a big surge, and new variants replacing the existing strains very quickly. And I think right now the another surge in Japan is primarily due to new variant. It's a mixture of different variants. But if you look at left-hand side graph, it's a trend of the proportion of new variant, and if you fit the curve, it's really exponential. Meaning it's very rapid to replace the original wild type COVID with new variant. So currently the major new variants are 3, and all of which have a mutation of the spiked protein on the surface of the virus, and all of them will have an increased transmissibility, and some of them have increased virulence. But the problem is the UK variant will be okay, but South African, the Brazilian variant, very worried, because there is a potential of immuno-evasion, meaning that antibody developed to the wild COVID virus may not be so effective, and actually some of the vaccine may not be effective for the variant in South Africa and Brazil, which is worrying. And this is right now the UK's trend. It's not reported, it's estimated. So the number of daily counts seems to be higher than the reported figures. So, Boris delayed implementation lockdown for 6 weeks, and he lifted despite the fact the cases were not going down. And then, the further restrictions were implemented at the time of Christmas, because there was no way to stop it unless he imposed it. And eventually, he implemented third lockdown in the new year, and that is still ongoing. Gradually, it's lifting from last month, and from next week, I think some of the non-essential shops, barbers, and gym will be open. But the process is very cautious. But a good thing about the UK is they are making effort. They learn lessons from these experiences. So they were the first country to approve the vaccine, Pfizer, Moderna, and not to mention AstraZeneca, from the 8th of December. And also they implemented massive testing right now. So it's kind of paying off, because if you look at the latest data yesterday, the number of deaths, daily deaths was around 10, and the new cases at 2,300, and testing capacity is 1.26 million per day. And surprisingly, vaccine are already administered to nearly 60% of adults, just one shot, but it's still effective, and 4.1 million are fully vaccinated. So it's paying off. So I think the UK is seriously learning from the lessons from the past failures. And I'm very impressed by the vaccine rollout currently in the UK. And if you look at per 100 population vaccine dose, UK is doing a very good job on the ranking of how quickly they roll out the vaccine. And the roadmap, lifting the third lockdown. So we are right now in step 1, but from next week, the step 2, as I mentioned. So basically, from next week, it's lifting lockdown. And so I think because of the lifting lockdown, we definitely do have another resurgence. Because knowing that very well, the UK is implementing rapidly to roll out the vaccine, as well as expanding testing capacity. And from 9th of April, I think for England, I think that twice a weekly free testing will be available to everybody, regardless of the symptoms. So they are also implementing massive testing from now on. And Boris Johnson approval rating is just improving. At the time of resurgence last year, around November, December, it was 33. It hit the bottom. But now, because of the vaccine rollout and the prospect for controlling the transmission on the second wave, it is going up to 45%. So clearly, whether or not the corona is tackled, that is really affecting the approval rating of the government. So let's talk a little bit about the similarity and differences between the UK and the Japan's response. So we have 3 basic approaches to infection control. So basically, there are only 3 approaches. Traditionally, it hasn't changed for more than 100 years. So first approach is disrupt the route of transmission. So wearing masks, avoiding treaties, washing hands, taking social distance, and the extreme approach is lockdown. So this is basically disrupted route of transmission. Second approach is to identify and remove the source of infection. To do so, we need early detection and isolation by mass testing. And the third way to control the transmission and infection is increase host immunity. That could be done by natural infection or vaccination. For prevention purposes, vaccination is the only way to do that. So right now in Japan, vaccination is a kind of hopeless because of the lack of availability of vaccine. So what Japan has been doing is either disrupting the transmission or identify and remove the source of infection. But to me, probably all of you know, the Japan's approach is primarily to disrupt the route of transmission. So, and there is a report from the Independent Investigation Commission on the Japanese government response to COVID-19 on the first wave. They are not analyzing this time of the second wave, but they called a strategy that relied on luck and people's effort. Because people's effort matters to disrupt the route of transmission. Because unless people behave properly, it doesn't work. So they interviewed more than hundreds of relevant people in the government or bureaucracy or academia. One of the high-ranking government officials said the makeshift response turned out to be all right. That was a very honest remark. And obviously, Japan didn't anticipate the full-scale pandemic such as COVID-19 in terms of registration and social system preparation, primarily because Japan didn't have experience in SARS or MERS as in other Asian countries. And also, the report suggested they intentionally suppressed the widespread testing, initially because of the capacity, but they used a very non-scientific argument that the PCR lacks accuracy. Massive testing will result in a huge number of false positive cases, all of which have never been discussed in other countries. So this is a very interesting report, but that is only the reflection of the first wave response last year. But testing level remains very low, and actually recent months, it was actually declining despite the increased number of cases. And unless you increase the number of testing, when you lift the state of emergency measures, it is very difficult to identify the early sign of resurgence. So what they have done is totally opposite to what the other countries have been doing. It's not about the capacity. It's not the people who do the test, because it's written in Japanese, but Kawasaki Juko has developed automated PCR testing, and up to 2,500 tests within 40 minutes per day. And it's really relatively small, and it can be put on the truck, and it can be mobile, and the cost is, I think, 100 million yen. It's not really expensive compared to the budget spent for example, go-to campaign. And if you buy 100,000 of them, you can do 2.5 million tests per day. So I don't understand why the government has not yet expanded this testing service, and they announced that they are going to do a focused mass testing up to 10,000 per day or something. It's just very, very small. So let me just talk about exit strategy for the second wave, which is discussed across the globe. We did exit strategy in Asia, Pacific, and Europe with expert across these countries. We are exchanging all the opinions, strategy almost every day with colleagues listed here. We published a Lancet about exit strategy from the first wave, and what matters fivefold: trust in the government and clear communication, active case finding, meaning massive test, trace, isolate strategy, and resilient public health system, and long-term strategy, all of which are very, very important for the success or failure from the exit strategy. And sorry. So talking about exit strategy, if you recall the three approaches to control the infection: disrupt the transmission, and identify the source of infection, and increasing host immunity. We know from the experience from last year what works and what doesn't actually. So we have accumulating the evidence for each of the strategy. So first one is public health intervention, i.e. It is about disrupt the route of transmission. So this is a very good meta-analysis published in the Science, and they look at the impact of mass restriction on mass gathering and business closure, and non-essential business closure, and school closure, and also other stay-at-home measure. So the most effective interventions are gathering limited to less than 10 people, and also school closures. And if you implement all of them, then additional stay-at-home measure may not be so effective. Of course, it's effective, but compared to others, it may not be effective because it's reasonable because you get infection outside the household if a household are free from infection. And if you get infected from your business area or school, and they bring back to the household, then household will become infected. That's the usual way of transmission. Secondly, the testing, identify the source of infection and isolate them. And there is also good analysis by a friend of mine, and published in Health Affairs recently. And they did a very detailed meta-analysis, not meta-analysis, descriptive analysis regression model, and to look at the what kind of factors affect the transmission in many countries. And they looked at the negative transmission, meaning the factors which reduce the transmission, peak match incidence. This is about first wave last year, so they are not analyzing recent big waves. But peak match incidence meaning at the time of the intervention. So the initial position will be very important. And also percentage 65, kids, these are important, but these are very difficult to change. But what you could intervene from the government perspective or public health perspective is test, trace, and isolate strategy. The massive testing will be paying off. And finally, increase the host immunity. So surprisingly, and it's a victory of science, within 12 months period, we have very effective, safe vaccines from different companies, which are very, very encouraging. And vaccines are very, very fantastic in terms of result. This is a result from Israel and real world data from the countries which are leading the vaccine rollout across the globe. And preventing symptoms, preventing admission, severe disease, and death, or if you do second dose, it's very, very effective. And surprisingly, preventing infection. We didn't know much about whether the vaccine will prevent infection, because the primary focus of the vaccine clinical trials is about whether it will prevent severe symptoms or death. So yet we need to be careful about interpreting this preventing infection about asymptomatic patient, but it's quite encouraging. But in the case of Japan, vaccine rollout is just delayed, and Switzerland, European Union countries, catching up very quickly, but Japan is at the level of Myanmar, which is in turmoil because of coup. So it's quite shocking. I will explain why this is the case. Here. So this is not the issue about Japan's response to COVID, but it's a historical, systematic problem because Japan has a history of vaccine lawsuit from the 90s. So the policymakers are very, very risk-averse in the case of vaccines. And also if you look at the HPV vaccine issues, Japan is fueled by media and anti-vax people. Japan has a huge vaccine hesitancy tendency. And thirdly, Japanese pharmaceutical industry is, in my opinion, is very similar to the financial sector in 1990s. Namely, it's very fragmented, small to medium scale. It's not global and lacks competitiveness. So I have warned when I was advisor to health minister 4 or 5 years ago, we compiled the strategy to revamp the Japanese vaccine industry to be competitive. And we warned specifically, Japan is not ready to tackle the pandemic. And all the issues which were described in the report published in 2016 are not still met. So we warned, they didn't do anything. So and it's quite shocking again that we knew that it's coming. And we knew that Japan needs to do something on the vaccine. And also, ironically, Japan did very well, luckily, because of people's effort and timing. And they managed to suppress the first wave, big wave, last March and April. And that kind of, early success led to kind of complacence. And they thought that that kind of so-called Japanese model will work. But if you look at what Japanese model consists of, it's basically people's effort, asking people to behave properly to disrupt the route of transmission. They didn't expand the testing, or they didn't prepare enough vaccines. So unfortunately, early success led to a kind of failure. So that is worrying me, because unless you have vaccines and testing at hand, continue to ask people to behave and be patient, I don't think it's sustainable. Also, we have vaccines, but that is not the magic bread, because there is an ongoing argument that we may never get herd immunity. Herd immunity is the status where quite a large number of population is immunized, so that transmission is declining below reproduction rate of 1. So it will be controlled. But the reason why we may never get to herd immunity are fivefold. One, it's unclear whether vaccine prevents transmission, although from different data set, this is probably true. So vaccine may prevent transmission, but not all of them. So right now, the data, the extent of preventing transmission ranged from 30% to over 90%. So maybe 60, 70 or 80%, I don't know, but the rest cannot be prevented. So second, vaccine rollout is uneven. So I showed the ranking of the vaccine rollout, then Israel, UAE, UK, US, some of the countries, European countries are doing well, but less of the countries, including Japan, just started. So unless, even in the UK, you suppose you achieved herd immunity, but African countries, Asian countries, the rest of the countries, if they are not enough vaccinated, but the vaccine is enough, there is always a risk of importation and resurgence. So unless everybody is vaccinated, there is always a risk of resurgence. And thirdly, new variants change the herd immunity equation, because they might have a potential for immuno-evasion. So the vaccine may not be so effective as previous thought. And fourth, immunity might not last forever. So right now, Pfizer vaccine seems to be effective for at least half a year, 6 months. But beyond that, there seems the antibody may be waning. So we need to look at the data. And we may need to repeat the vaccine booster at some point. And finally, vaccine might change human behavior. The risk is that, I got second shot, I don't have to wear a mask, I don't have to take social distancing, which is not true. Because as I said, vaccine may not be 100% preventable and risk of new variant. So this is the data this is the vaccine rollout. And quite a few countries, actually, many countries are not yet rolling out the vaccines. And even if the prevention effort, you are vaccinated, if prevention efforts are relaxed, there will be a surge of cases And this is the simulation model. So this is the figure with the current protective behavior, no vaccination. And if you implement the vaccination and fast vaccination rollout, then even with the existence of B117 UK variant, the cases will be reduced substantially. But if you vaccinate very quickly, but if you don't impose mask wearing, social distancing, the B117 will spread very quickly. So we may need to continue mask wearing, social distancing for a while, I would say, next couple of years. And in fact, in cases rising again, feared by new variants. In the case of France, last month, end of February, they managed to suppress the transmission seemingly, but new variants are replacing the wild original one very quickly, and that is reflecting the global trend. And end of January, we are seeing the hope that cases were going down, but now it's increasing again. So to tackle the SARS variants, we need to do genetic sequences because not all countries are doing genetic sequence, including Japan, because Japan is trying to scaling up these genetic sequences. But A, testing is still limited. B, they don't do efficient way of sequencing because all the work is primarily done by Institute for Infectious Disease, National Institute for Infectious Disease. In the UK, all the major universities and who are doing genetics are creating consortium. So they are doing nationwide genetic sequence very efficiently. But I'm hoping that Japan will take that route again because the current surge is definitely due to new variant. Finally, let me talk about my proposal on zero COVID strategy. So there is always an argument whether we should, revamp the economy or control transmission. And there is a common thinking that control infection will harm the economy. But if you look at data, which is not true, there is no trade-off between infection control and the economy. The countries which are eliminating or suppressing the infection are actually the countries which are doing very well in terms of the economy. It's obvious because unless you have a confidence that I can do economic activities or social engagement, the people will refrain from engaging in this kind of activity. So it is extremely important for the government to give the people the confidence that we can do economic activities. But right now, the government is just asking people and be cautious, which may not be sustainable. And it's also harming the economy, in my opinion. So, I'm very proud Osaka Naomi won the Australian Open. And if you look at the situation in Victoria, in Australia, people are, although some of them wearing masks, but people gathered, are meeting very extensively. And because this could be made possible because state of Victoria did eliminate the COVID very, very extensively. For example, its approach is massive because with just 5.8 million population, less than half of the Tokyo metropolitan area's resident, testing capacity is over 2 million. And before the Australian Cup, they did massive testing and tried to eliminate. Elimination is not eradication, to suppress the cases very close to zero and maintaining it by expanding testing. So the choice is whether you will go so-called with COVID. I don't think it's accurate English, but in Japan, people and the government is employing with COVID approach. That is mitigation. So, let the COVID spread a little bit, but try to hammer and dance and dance nicely with COVID, living together, or eliminate COVID, zero COVID. It's not eradication, okay? Wiping out eradication is almost impossible. What I'm talking about, try to suppress the COVID as low as possible. So I'm a big fan of a zero COVID approach, and there is a growing number of experts who favor this approach. And recently, in the French Institute of Economy, they published zero COVID strategy protects people and economies more effectively. I wrote in the BMJ, British Medical Journal, Japan should aim to eliminate COVID, and in the Lancet, the case for no COVID. There are growing number of people who support this approach because the data show that zero COVID will protect the people and also the economy. So this is a very useful schema for the exit strategy for the second wave. So many countries are locking down, and France and Italy and UK did a third lockdown. But the important thing is not whether or not the country will implement lockdown. It is about the exit strategy, how to maintain the very small new cases. So important thing is not to start the lockdown, but the important thing is what will be done at the time of exit. So right now, UK is massively vaccinating the people and expanding the testing, as shown here. On the contrary, what Japan is doing right now is not expanding the testing, as they say, and vaccination is not available to even the elderly people. So I'm very worried about the current situation in Japan, because the worst thing about the mutation is in the situation where there is some immunity, suboptimal immunity, and many cases. Because it's like a people, the COVID virus would like to survive, and virus will mutate, improve their capacity to survive when there is a stress. Without stress, you can be as you are, as you are right now. With some stress, you make some effort to adapt. With much stress, you just give up. So suboptimal immunity with large number of cases, that's the ideal environment for the new variant. So I'm worried that Japan is entering that situation right now. So in fact, there are emerging variants in Japan. COVID near 60-70% are already new variant, the UK variant. And Tokyo, because of a very small number of testing, we don't know yet the whole picture of it. But worried, very worried, because E484K mutation on the spike protein, it is observed in the Brazilian and South African mutation variant, which will cause immunity evasion, meaning that the vaccine may not be effective enough. So that is increasing in Tokyo or elsewhere. So I'll stop here. So I finished with the report and remark by Professor Kiyoshi Kurokawa, who was the chair of the Nuclear Accident Independent Investigation Commission of the National Diet of Japan. And he, at the preface of this very fantastic report, but the government has ignored since its publication in 2012. But he said its fundamental causes of Fukushima accident are to be found in the ingrained convention of the Japanese culture. So our reflexive obedience, our reluctance to question authority, our devotion to sticking with the problem, meaning sticking with the status quo, our groupism, thinking, and also our insularity, kind of exceptionalism, Japanese special, so we'll be okay, that kind of mindset. So this kind of mindset is already observed in our response to COVID. So I think it's time to get serious. Otherwise, I think we have a more problem. So I stop here. So thank you so much.
Thank you very much for this insightful presentation. We are all affected by the pandemic be it in the UK, be it in Japan, be it anywhere else on the planet right now. So we just go about our lives and are affected by it every day, but we hardly ever get it explained that beautifully and clearly like you did just now. Thank you very much. So now let's jump into a few questions that we received during the seminar and even before. First of all, most of us participants here are actually in Tokyo, and what we seem to care about a lot is the Olympics. We saw that the Australian Opens, like you just showed the picture, a global event happened. And what would you say about the Olympics?
The Olympics? I would say it's a mission impossible. But government is, everybody knows it's almost impossible because, Australian Open is just one of the 4 big tournaments in tennis. But to hold the Australian Open, it's a huge task because they implement 2-week quarantine and massive testing in advance to eliminate the transmission in the community. But right now in Japan, just 100 days before the Olympics, we are seeing the big, beginning of the big surge again, primarily due to new variant. And, even though they don't accept the foreign visitors, but if you include athlete, journalists, delegates, up to 100,000 people without quarantine, how could you prevent the transmission? So, of course, many athletes will not come because of the risk. So, of course, the full-scale Olympics is, it's gone. But even holding the Olympics is a big if, and better not to do that. But of course, politicians cannot say that is a huge blow to the government. So I'll stop here on that.
It's just between us. So we'll see in probably a few weeks' time how it's going to develop.
Maybe they can hold it under the lockdown or something. I don't know.
Only Japanese athletes.
Yeah, it's a national sports festival then. It's not Olympics.
Indeed. I just checked the numbers for Osaka today was 700, more than 700 cases. Tokyo alone has 399 new cases today. So since the semi very mild lockdown is over, cases have been increasing.
It's a tip of the iceberg because I think compared to Osaka, Tokyo's testing is low. And and Tokyo has not tested for genetic sequencing, so we have to be very careful about this increase.
So in Switzerland now it's even will be possible to do self-testing at home.
Yeah.
And in Japan, as you mentioned, test numbers are still very low, and
very low.
There is no tests like drive-through centers like we see in other countries. Can you maybe say something about the latest schedule and the process of vaccinating, of testing?
Vaccination, so honestly, I don't know, because even my friends who are giving vaccine or carrying the February patient are not vaccinated. Although the big hospitals, university hospitals, even residents are vaccinated. But priority is not doctors, but to protect the elderly people. So priorities are different. Of course, medical personnel need to vaccinate it, but the important thing is to prevent the deaths and severe cases among the elderly, because we see increasing clusters at the nursing homes. So, but they announced that they are going to, they will start vaccinating elderly people from May or end of April. But unless I see the vaccines, I don't believe them. And I don't think the general public will be vaccinated toward the end of this year. So I was asked by quite a few friends from the UK or US living in Japan what to do. And I said to them, go back and get vaccinated and come back.
That is also what we were told, but then we realized that back in Switzerland, we would not be welcome to get the vaccine either. So.
So that's a problem. But yeah, so it's a shame that countries like Japan so stagnated in terms of vaccine rollout. But again, it's historical and systematic, and also, yeah, unfortunate.
Will Japan learn before the next pandemic?
Well, yeah, look, if you look at the Fukushima and also H1N1 report, and they did a review of H1N1 response in 2009, and all the issues about the PCR testing, preparation for the pandemic, it's there. And people forget after a couple of years. So I'm not so optimistic.
Let's move to a slightly different topic before we all get too depressed.
No. I think, but on the contrary, governmental response, I'm not so optimistic because it's quite secluded area. Particularly infectious control is done by National Institute for Infectious Diseases. But if you look at the private sector, the massive testing is done, and they are responding to market needs. And I'm very encouraged. And also the way vaccine is developed. I'm on the scientific advisory board of CEPI. Luckily, Japanese Prime Minister Abe, supported the creation of CEPI, which invested in Moderna and Oxford from 3 years ago. And not for COVID vaccine, but for the MERS vaccine. We knew that genetic new next generation vaccine are important, and it paid off. So indirectly, Japan supported development of COVID vaccine. And the way the pharmaceutical industry is working is different. And so you don't have to create the vaccine by yourself. So you find a good venture and invest in it and scale up and using your ecosystem. So I think there are many things the Japanese pharmaceutical industry can learn from the lessons and also the recent vaccine development, new technology. And of course, this first generation COVID vaccine, many companies are now looking at the next generation of the COVID vaccine, not focusing on spike protein antibody. So there's much to learn from that kind of, so I'm very interested in private sector support on this as well. So CEPI is a good example, and I'm very proud that Japan has contributed to it, although they didn't do well in terms of domestic response. Global health, they did very well.
So there's still hope. That's good to know.
Of course, we have to be optimistic.
The world has seen other very infectious diseases. There was, 100 years ago, there was the Spanish flu, but in more recent history, as you mentioned, there was SARS, there was MERS, there was Ebola. Of course, they're all transmitted differently and different levels of contagious. But why is it that it was COVID-19 that spread globally?
Why? Because obviously people are moving around and of course more interconnected. But flip side of the coin is that we have more advanced technology. So the issue of balance between these two, whether or not we can suppress or prepare for the next pandemic. I'm very optimistic in terms of science, but in terms of people behavior, too much rely on people's behavior is very risky and not sustainable. So I'm hoping that, so we are shifting from virus to genetic, and from medical records to big data, data science. And so we see a new era of epidemiology and infection control. So on that front, I'm very optimistic power of science technology. But on the other, people's behavior have not changed for the past 100 years or more than 100 years. And relying on it alone is very, very risky because people tend to get together. That's the human nature.
It is indeed. You also briefly mentioned in your presentation the media, and I think what was, not just me, but what was very widely also mentioned in general is the influence of social media, of conspiracy theories.
That's everywhere. And it's becoming, because those who believe in theory A will look at Twitter who are advocating theory A. And so the world is really fragmented, unfortunately. But an important thing for the government is to continue to provide the most accurate, updated information. But unfortunately, the Japanese government response on COVID is a mixture of scientific and I would say non-scientific argument, particularly if you look at the testing strategy and testing accuracy and principle. I don't think they are doing well. But yeah, but if you yeah, and also TV and yeah, they would like to have attention, so they tend to bring in extreme views. But people, I think, are fed up. So I think it's important to have someone, very opinionated, but trusted people. Not at the time of COVID, because we have so many so-called experts on COVID on TV every day. But most of them are not. They have not published any papers. They are not actually the expert on infection control. They are probably good physician, but they don't know anything about controlling transmission or even the. So yeah, that's everywhere. Even here, there's always. But I don't see TV show like in Japan bringing in very new talent every day. Saying very strange things. So, but the fact is, people like it.
As long as it pays off for someone. Yeah. Indeed, and I think here, well, the audience is a quite international community, so we get to see what happens, of course, in Switzerland, what happens in Europe, and internal. It's maybe we have a more wide income of different opinions, of different experience also from our home countries, whereas maybe many local people who only focus on local outlets get a totally different opinion of what this is all about.
Right. Because we don't know. Yeah, we have known quite a few things about this COVID, but at the beginning we didn't know much about the asymptomatic transmission, long-term consequences of disability. And of course, immunity waning. We didn't know much, but now we have some knowledge about COVID. But we still don't know many things. So it's important to bring different information together and discuss and also come to the consensus. If you focus too much on a specific country, specific politics, you end up with daily fight with unnecessary Twitter war, which is just waste your time.
Maybe just to finish, a little outlook, what is to be expected in the months, years to come?
So we have a hope for vaccination, but I think this situation will continue at least for the next couple of years. I'm not quite sure it's 2 years or 3 years until this COVID is becoming a seasonal endemic disease. So we may need to continue social distancing and wearing a mask. This kind of stuff will continue for a while, I think.
Thank you very much for this, for being very open with us about the COVID situation in the UK, in Japan, in the world, and also for not fearing to tell us about what might happen in the future.
Yeah, but this is my personal opinion, so you should check out, and also you should seek yourself, because it's extremely important for you to be updated in terms of information. And also, because Japan is not doing well, but they are good experts, and they are not well listened to these days. But I'm hoping to support Japan because I'm planning to go back this summer. So
for the Olympics.
Or not Olympics. I need to find a job, but if you have somebody behind your screen, I'm happy to negotiate with them, but I'm looking for a job in Tokyo.
We'll be happy to support you. Thank you very much.
It was fun. Thank you. Thank you so much.
Thank you very much. I'll pass back to our president for a few closing remarks.
Shibuya Sensei, absolutely interesting. Really, thank you very much for sharing not only the information, but also your thoughts, the way you see the situation and this highly complex problem with so many information out there, so many controversial information out there. We really do not know what to believe, so it's really important to have a specialist say a few words on what is actually happening. Thank you very much for that. When you're back, Shibuya Sensei, please keep in touch. We also would like to follow up on this because Corona is not finished. It's definitely not the end. We are in the midst of it. Most likely we have to live with it and learn to live a new normal. And with this, expert advice is definitely going to be highly appreciated. Again, thank you very much for sharing the time with us and your information out of the UK. With this, I would like to close today's webinar. Thank you very much for attending. Bye-bye.